Our topic is ischemic strokes. Our population-specific consideration pertains to older adults. In this part of our presentation, we'll be focusing on how ischemic strokes uniquely impact older adults and why understanding their age, cultural background, and socioeconomic situation is essential for providing effective care and education. Age-related factors make strokes more likely and symptoms harder to catch. Older adults, especially those over 65, are at a higher risk for ischemic strokes because of natural changes that happen as we age in the presence of chronic conditions. Age-related factors include the following. Vascular changes, because as people get older, their blood vessels become stiffer, which makes it easier for clots to form and block blood flow, leading to a stroke. Comorbidity conditions such as hypertension, diabetes, atrial fibrillation, and hyperlipidemia are more common in this age group, and all of these raise stroke risk. Delayed symptom recognition, because stroke symptoms like confusion or weakness can be mistaken for normal aging, which can cause delays in getting emergency help. And as you all know, in stroke care, every minute matters because time is brain. Functional decline, because many older adults may have mobility problems, vision or hearing loss, or memory issues that make it harder to recognize stroke symptoms or react quickly. Cultural beliefs and practices can shape how older adults understand stroke symptoms and respond to them. Cultural factors include the following. Beliefs about illness and aging, because in some cultures, stroke symptoms may be seen as a normal part of aging, which may lead to delay in seeking medical care. Home remedies and family decision-making, because some people may turn to herbal treatments or wait for family input before going to the hospital. Language barriers, because older adults who don't speak English, they may have trouble understanding symptoms or instructions. That's why it's important to provide materials that are translated in their language and to also use clear, simple language. Health literacy, because health literacy means how well someone understands and uses health information to make good decisions about their care. Many older adults struggle with this, not just with medical terms, but with understanding health overall. Some prefer hearing instructions over reading them, especially if they have vision problems or limited education. So a helpful tip would be to use pictures, interpreters, and just, like I said before, simple language when teaching stroke signs and prevention, because this just helps make the information easier to understand and remember. Socioeconomical factors, because many older adults deal with financial and social challenges that make it harder to prevent or recover from a stroke. Socioeconomic factors include fixed income. Some older adults live on limited retirement money, which means they may skip medications or delay doctor visits to save money. Access to care, because they may have trouble getting to appointments because they don't drive anymore, or they live too far from a clinic, or they just don't have reliable transportation. Insurance gaps, because not all older adults qualify for full Medicare. Some didn't work enough years, or Medicare sometimes just requires specific requirements for eligibility, such as being a U.S. citizen. Living alone, because many older adults live alone, which increases the risk if they have a stroke at home. No one may be there to notice symptoms like slurred speech or confusion. They may be too weak or disoriented to call 911, or they may just wait too long thinking the problem will pass. Lastly, digital divide, because some older adults don't use the internet or smartphones, which means they may not have access to telehealth. They may not be able to get reminders or look up health information online. This limits their ability to stay connected with providers and manage their care. Our topic is ischemic strokes. I'll be explaining the pathophysiology of an ischemic stroke. There are two types of ischemic strokes. There's thrombotic and there's embolotic. Thrombotic refers to a stroke that is caused by a clot, while embolotic refers to a stroke that is caused by a dislodged clot. This means a clot forms somewhere else in your body and it travels to your brain and occludes a blood vessel. How does this happen? An ischemic stroke happens when something blocks the blood flow to a part of the brain. This blockage is usually a blood clot, or it can also be a buildup of fatty plaque in the arteries that supply the brain. This is also known as atherosclerosis. So, imagine the brain like a busy city and the arteries are like highways delivering oxygen and nutrients. When a blood clot gets stuck in one of these arteries, it's like a traffic jam. Nothing can get through, right? So because brain cells need a constant supply of oxygen to survive, even a short interruption can cause damage. When the blood can't get through, the brain cells in that area begin to die. This damage is what causes the symptoms we see in a stroke, like that sudden weakness on one side of the body, that difficulty speaking, that blurry vision, or even loss of vision. The faster we can restore blood flow, the better chance of saving brain tissue and reducing long-term damage. That's why you may have heard the phrase, time is brain. In conclusion, ischemic strokes are caused by blocked blood flow in the brain, leading to oxygen deprivation and cell death. Fast treatment is critical to prevent permanent damage.
Elevated hematocrit and hemoglobin levels are often linked to severe or major strokes as the body compensates for reduced oxygen supply to the brain. An increased white blood cell count may signal an infection or a response to physiological stress or inflammation. Blood glucose and hemoglobin A1C levels are assessed to determine if the client has diabetes and whether it is well managed. Along with routine laboratory tests, the primary healthcare provider generally orders prothrombin time, international normalized ratio, and activated partial thromboplastin time to establish baseline data before initiating fibrinolytic or anticoagulation therapy. A computed tomography, perfusion scan, or computed angiography is used to definitively evaluate a suspected stroke and assess the extent of brain tissue ischemia. Magnetic resonance angiography, along with multimodal techniques like perfusion-weighted imaging, improves MRI sensitivity in detecting early changes in brain blood flow. Ultrasonography may also be conducted. A health history and workup for an ischemic stroke typically involves gathering comprehensive information to guide diagnosis, treatment, and prevention of further strokes. The process includes symptom onset, symptom progression, activity at onset, previous stroke or TIA, and risk factors. A physical assessment for signs of neurologic deficit such as weakness, sensory loss, speech difficulties, and changes in vision or balance should be conducted. High blood pressure is a primary risk factor for ischemic strokes and needs to be monitored. Look for signs of heart disease, carotid bruits, or other vascular abnormalities. A psychosocial assessment should be done of the patient's response to the illness in terms of changes in body image and their ability to perform ADLs. Work with the patient's family and friends to identify any difficulties with coping or personality changes. Screenings for depression should be initiated. Inquire about the patient's financial situation and occupation, as these may be impacted by the lasting neurological deficits and potential for a long recovery. Early involvement of social services or psychological counseling can improve coping mechanisms.
Some nursing interventions for an ischemic stroke. You want to administer TPA within the therapeutic window of 3 to 4.5 hours, which will bust up the clot causing the ischemic stroke. You also want to monitor for signs of bleeding because of the TPA and vital signs, monitor blood pressure, and watch for any cardiac arrhythmias. It's important to assess neurological status every 15 minutes for the first hour to watch for any increase in ICP or decrease in level of consciousness. You can assess neurological status with the NIH stroke scale. It's also important to assess airway, breathing, and oxygen. Stroke patients have an increased risk for aspiration because of difficulty swallowing or impaired gag or cough reflex. So that's important to monitor. And during a stroke, it's important to act quick because time equals dead brain cells.
So for our medical treatments, because ischemic strokes are caused by clots that are impairing perfusion to the brain, basically what we want to do is bust that clot. Get that clot out of there so blood can get flowing back to the brain and we can restore that oxygen, restore that perfusion. And one way we can do this is through IV thrombolytics. One common example of this is Alteplase. These medications are basically just clot busters. We give them IV. It makes your blood super thin, busts those clots up so that way perfusion can be restored. Not every patient is a candidate for IV thrombolytics though. They have to be at the hospital within 3 hours of the stroke. If they have any evidence of active bleeds, if they're on anticoagulants, if they're older age, and if they have had a stroke within the last 3 months. Those are just some examples of patients who cannot receive IV thrombolytics. It also puts patients at high risk of bleeding, so you want to make sure you monitor them for any type of hypovolemic shock or hemorrhaging. Another intervention that we can do is endovascular. So for patients who cannot receive any of those IV thrombolytics, we will do endovascular interventions, which include mechanical embolectomy, which is basically where we just go in and surgically remove that clot. And then lastly, just implementing safety precautions. Depending on how severe a patient's stroke was, they may be at higher risk of falling, of aspirating on any fluids or any type of food. And they're also at risk for bleeding, especially if they received IV thrombolytics. So we just want to make sure we implement those safety precautions such as bed alarms, making sure they're in high Fowlers when they're eating, things like that. So for patient education, one big one is medication education. If this patient did not come in on any medications, they are more than likely leaving with medications, such as anticoagulants, keeping that blood thin, blood pressure meds, keeping that blood pressure low, and then statins, going to keep that cholesterol down. Make sure you educate them on why they're taking these new medications, the dosage, the name of the medications, and possible side effects and how to manage these side effects. That way they're aware and they understand. Next up is lifestyle changes. This is a big one. Exercising. If they don't exercise, try to maybe encourage some exercising, such as walks or anything that they're willing to do. Eating a healthy diet with low saturated fats, some fruits and vegetables, help keep a heart-healthy diet, and smoking cessation. This can help keep blood pressure down. And yeah, depending on the severity of the stroke, a person may need to go to rehab to receive more physical therapy, occupational therapy, and even possibly speech therapy. And these is super important to educate on so that way the patient is aware, and even providing just emotional support for them, because losing some type of independence can be really hard for a person. So just being there and educating them on what to expect and even the benefits of the therapy can be super helpful. And last but not least, we have recognizing the signs and symptoms of a stroke as well as signs of post-stroke depression. If you've had a stroke before, you are at risk for having another one. So educating not only patients but also the patient's family about symptoms of a stroke and recognizing those symptoms of a stroke can be life-changing, especially if the patient can get treated in time. One acronym that is super common and well-known is BFAST. So balance,
eyes, face, arms, speech, and time. Balance if they're unsteady, eyes if one's drooping, or super blurred vision, even. The face, if one side of the face is drooping, arms, one-sided weakness again. Speech, if they have slurred speech or they're just not really making sense. And then time, it's super important to just call 911 and get them to the hospital as fast as they can. Teaching patients this and their families can really help save a life, or at least reduce the severity of the stroke. And then post-stroke depression is often kind of forgotten about in a way. Patients who have suffered a stroke, and especially if they've lost abilities, are at risk within 3 months, anytime 3 months after a stroke really, of getting depression. More at-risk patients are those who have had a history of depression, and then those who have lost any physical or cognitive abilities. So just educating patients and their families to watch out for those symptoms of depression and getting them help if they need it.
So now that we've finished the presentation, we have a short little interactive activity that you can participate in if you'd like. Just go ahead and click on the link on the PowerPoint and it'll take you to a website called Book It. It's going to be a interactive activity in the form of a game, and we have 10 questions for you to answer. Very simple questions, just summarizes what we went over in the PowerPoint. There's some multiple choice, some type in the blanks, and like I said, it's in the form of a game. So just go on and do the best you can, and hopefully it's a good recap of what we went over in the slideshow. Alrighty, so that's going to be it for our PowerPoint on ischemic strokes. This is going to be our reference page. We have a couple of references that every person pulled from, as well as we wanted to reference the material we learned in class. And then finally, I linked the one-page paper. That was my part of the project. That's my responsibility. So it is there to go check out. And if anybody has any other questions, feel free to let us know. But I hope you learned a little bit about ischemic strokes. Thank you so much for being here and listening.